Hey guys, I'm Dr. Lauderdale. Welcome back for another LMG Minute. The month of June is Alzheimer's and Brain Awareness Month, so we're going to do a couple of segments on Alzheimer's and dementia. Today's topic is Alzheimer's and dementia. Dementia is a general term used to describe thinking and memory problems severe enough to interfere with a person's daily life. Alzheimer's is the most common cause of dementia, but there are several others. Worldwide, more than 55 million people live with Alzheimer's or other dementia. Today we're going to discuss 10 early signs and symptoms of dementia. If you or your loved one develop or notice any of these symptoms, please schedule an appointment with your doctor to discuss. Memory loss that disrupts daily life. One of the most common signs of Alzheimer's dementia, especially in the early state, is forgetting recently learned information. Others include forgetting important dates or events, asking the same questions over and over, and increasingly needing to rely on memory aids such as reminder notes or electronic devices or family members for things they used to handle on their own. Challenges in planning or problem solving. People living with changes in their memory due to Alzheimer's or other dementia may experience changes in their ability to develop and follow a plan or work with numbers. They may have trouble following a familiar recipe or keeping track of monthly bills. They may have trouble concentrating and take much longer to do things than they did before. Difficulty completing familiar tasks. Patients oftentimes find it hard to complete daily tasks. Sometimes they may have trouble driving to a familiar location, organizing a grocery list, or remembering the rules of a favorite game. Confusion with time or place. People living with Alzheimer's or other dementia can lose track of dates, seasons, and the passage of time. They may have trouble understanding something if it is not happening immediately. Sometimes they may forget where they are or how they got there. Trouble understanding visual images and spatial relationships. Some people living with Alzheimer's or other dementia could experience vision changes. This may lead to difficulty with balance or trouble reading. They may also have problems judging distance and determining color or contrast, causing issues with driving. New problems with words in speaking or writing. People living with Alzheimer's or other dementia may have trouble following or joining a conversation. They may stop in the middle of a conversation and have no idea how to continue, or they may repeat themselves. They may struggle with vocabulary, have trouble naming a familiar object, or use the wrong name. An example of this may be calling a watch a hand clock. Misplacing things and losing the ability to retrace steps. They may lose things and be unable to go back over their steps to find them again. He or she may accuse others of stealing, especially as the disease progresses. Decreased or poor judgment. These individuals may experience changes in judgment or decision making. For example, they may use poor judgment when dealing with money or pay less attention to grooming or keeping themselves clean. Withdrawal from work or social activities. These individuals may experience changes in the ability to hold or follow a conversation. As a result, they may withdraw from hobbies, social activities, or other engagements. They may have trouble keeping up with a favorite team or activity. Changes in mood and personality. These individuals may experience mood and personality changes. They can become confused, suspicious, depressed, fearful, or anxious. They may be easily upset at home, with friends, or when out of their comfort zone. If you notice one or more signs in yourself or another person, it can be difficult to know what to do. It's natural to feel uncertain or nervous about discussing these changes with others. Voicing worries about your own health might make them seem more real. Or you may fear upsetting someone by sharing observations about changes in his or her abilities or behavior. However, these are significant health concerns that should be evaluated by a doctor, and it's important to take action to figure out what's going on. Schedule an appointment with your doctor to discuss these concerns. Thanks for tuning in. Make sure you subscribe to our channel, like this video. We look forward to your comments. Make sure to hit the notification bell so you'll know when we drop our next video. Thanks, guys.